Good morning. I know that we are on a bit of a clock, so I'm going to jump right into it. Just with two themes for today. The first is vaccines and vaccine distribution, and then the second is our response to the news about Canada taking vaccines from the COVAX facility. D'abord, il y aura deux thèmes rapidement aujourd'hui. Le premier, c'est notre système de distribution des vaccins. Et après, les nouvelles que le Canada a retiré des vaccins du mécanisme COVAX. With respect to vaccines and vaccine distributions, I really want to echo the growing chorus of pleas from the public, from civil society, from our health experts, and even from the other parties for the government to please be more transparent and to please provide clear information and messaging to Canadians about the state of our vaccine delivery, our expectations about when they will arrive in Canada, how soon they come, how many will come. We are all confused now. The information is not clear. It is often disguised in good news messages about things that aren't going to deal with our immediate problem. And so it is very important for the government to do a much better job in communicating. En ce qui concerne les vaccins et les livraisons des vaccins ici au Canada, moi, comme tout le monde, je suis complètement confus des messages mixtes du gouvernement. C'est une nouvelle un jour, une différente nouvelle une autre journée. La public, les experts de santé, les provinces, tout le monde et les autres partis aussi, nous sommes tous confus et on demande tous ensemble que le gouvernement soit beaucoup plus transparent, beaucoup plus clair en ce qui concerne les prochaines semaines et mois de livraison de vaccins ici au Canada. People need to have confidence in the system. They can't have confidence in the system if they don't know what's happening, and they really just want some straight talk about vaccines. With respect to the COVAX facility, I'm sure that you've all heard the news yesterday that Canada became the only G7 country to take vaccines from COVAX. COVAX is a facility, it's a global vaccine sharing initiative that was established by the World Health Organization and Gavi, the Global Alliance for Vaccines and Immunizations. What this facility was designed to do was to ensure that poor countries could have a fair access to supplies of vaccines. And many poor countries are completely dependent upon this COVAX supply because they cannot afford to buy vaccines. The CEO of Gavi has said that the most important role of the COVAX facility is to supply vaccines for countries that otherwise would not get access. So why is this a bad decision? It's a bad decision for Canada to take vaccines from this facility because first, it hurts Canadians. Health experts have said that unless vaccines are shared equitably, it could be years before the coronavirus is brought under control, exactly because there can be new variations, new mutations that our vaccines cannot control. So this is a global problem and it requires global vaccination. Next, it hurts our economy. Canada is a trading nation. The longer that COVID continues to circulate globally, the more it hurts us and our trading relationships. And then it hurts our global standing. The top headline today on the BBC was, and I quote, "Canada defends taking vaccines from scheme for the poor." This is the top story about Canada today in the international newspapers. Canada has already been criticized heavily for having used our wealth and influence to corner the market globally on vaccines. And we know that we're sitting on a supply that would allow us to vaccinate our population 4 to 5 times over. COVAX was supposed to prevent that. And what we have done now undermines the very premise of this scheme. And so this is the time for Canada to stand and be counted. This is a time for us to do what we say, which is to say that we are going to care for our neighbors, and that extends beyond our borders. Alors, le fait que nous avons retiré des vaccins du mécanisme de COVAX est un énorme problème. C'est un problème parce que le COVAX est un mécanisme créé exactement pour assurer qu'il y aura un accès équitable aux vaccins pour les pays du monde et surtout les pays pauvres qui sont complètement dépendants sur ce mécanisme pour recevoir les vaccins pour la population. Et les organisateurs du mécanisme, ils ont dit qu'en fait, c'était ciblé sur les pays qui n'auraient pas accès aux vaccins autrement. Alors, notre décision de prendre des vaccins ou de retirer des vaccins du mécanisme COVAX, c'est une mauvaise nouvelle pour les Canadiens parce qu'on sait que le virus et la pandémie globale ne serait jamais en contrôle si nous n'avons pas une vaccination mondiale. On sait qu'il y aura des mutations aussi. Et on sait que le plus temps qu'il prend pour avoir une vaccination mondiale, le plus de temps ça va traîner de retourner à la vie normale. On sait que c'est mauvais pour notre économie autant qu'un pays qui est dépendant sur l'échange et des relations globales. Et finalement, c'est très mauvais pour notre réputation globale. C'est la première nouvelle aujourd'hui dans les journaux et dans la presse internationale que le Canada défend sa décision de prendre des vaccins d'un mécanisme intentionné pour les pays pauvres. Alors, c'est le moment maintenant pour Canada à dire que nous allons être des bons et respectueux membres de la communauté internationale. Un pays comme le nôtre qui a déjà suffisamment de vaccins pour vacciner toute notre population 4 et même 5 fois ne devrait jamais prendre des vaccins d'un mécanisme comme ceci. Et nous sommes le seul pays G7 d'avoir le faire. And so, I think that it is beyond ironic that our international development minister was sent out to justify why we have decided not to do our fair share to support developing countries. This is the wrong decision. This is the wrong time to make this decision. People in Canada do not want this kind of decision made in their name. And so we are asking for the government to either rescind this decision or alternatively make up for whatever doses it has taken out by returning them to the COVAX facility so that our neighbors, our international neighbors, can enjoy the same protection that we do so that we can get out of this pandemic together because we are all in this together. Thank you.
Thank you, Madam Paul. We will now begin with the questions. So one question, one follow-up. On va commencer avec les questions. Une question, puis un suivi. If you'd like to ask a question, please use the raise hand feature and identify your organization. Si vous voulez demander une question, s'il vous plaît, utilisez le lever la main et puis identifiez votre organisation. Merci. On va commencer avec David Thurton. We'll commence with David Thurton.
Hi, Madam Paul. Thanks so much for taking our questions. COVAX describes itself as a facility that provides vaccines equitably just for poor countries and I guess wealthier countries like Canada. So is it fair to characterize this as simply a program for poorer countries and to attack the Liberals for exercising its options from it?
This was a mechanism that was designed to be the global sharing facility. It was intended to pool all of the vaccines from all of the different manufacturers and then share them equally. But that hasn't happened, of course. What happened is that wealthy countries, including Canada, did an end run around that and went directly to manufacturers and bought up the global supply of vaccines. And so we already know that this facility doesn't even have the vaccines that it needs to protect the countries who are members. What Canada essentially did with its participation in COVAX was to hedge its bet. This was really about saying we're going to buy up as much of the global supply as we can. And then just in case that doesn't work out, we're going to do this. And so for a country like ours, who again has already really been one of the countries to corner the global market, we've got enough vaccines to vaccinate our population many times over. We should not be double dipping into this mechanism. It is just it's very bad for Canadians. It's very bad for our image. And again, we're the only G7 country and only a couple of countries around the world, wealthy countries, who have decided to do this, even though they have the option to do it. Having an option doesn't make it right.
But the COVAX describes itself on its website as a valuable insurance policy to protect their citizens. You know, they're saying that this is an insurance policy. This could be an insurance policy for wealthier nations. So I don't necessarily understand where you're coming at with this. But can you tell me this? How could you justify to Canadians passing on millions of extra doses in the next few months? I mean, you're talking to Canadians right now who are, you know, some of whom, you know, could die from this illness. How can you justify, you know, if you were governing, if you were prime minister, or, you know, just as an opposition party, saying that you want to pass up on these doses that are needed at this time?
Well, this is a very frustrating position for me to have to be in, because it's the government that should be explaining why it decided to pass up on, pass up on those doses. Many governments around the world are explaining why they passed up on those doses, and it's for the reasons that I said, David. If we do not get our global population vaccinated, then people in Canada will never be safe. As we're vaccinating people here, if we are not doing our fair share to make sure that vaccines are available elsewhere to those who can't afford them, then the virus will remain out there. It will begin to mutate. Those mutations will be resistant to the vaccines that we have, and then we're right back where we started. And so we have to see and understand that protecting people around the world is something that we can be doing to protect ourselves. And I will also say what it seems like none of the leaders from the other parties are willing to say, which is that we do have a responsibility to people in other countries. We are global citizens. The pandemic has taught us that we are interconnected. And so, you know, beyond all of the practical reasons I've given you for why this is a bad decision, there's also the moral imperative for a wealthy country like Canada, who, as I said, has cornered the market, being one of the countries to corner the market on vaccines, not to be dipping into a supply which is already overextended for countries that have no other recourse to get vaccines.
Thank you, David. Next question, James Murray. One question, one follow-up, please. Oh, you're muted.
Can't hear you, James. You're on mute.
James.
There, am I back on?
Yep.
This is an important issue that I'm glad you've brought up, because we've been covering this issue for a long time on COVID-19. It's been a year. And if we don't find ways to make it a global pandemic solution, it not ending is going to be our legacy, and that should not be Canada's legacy either. What can Canadians do to reach out to the government and explain that this needs to be solved?
People in Canada should write, to their MPs, write to the government and say, not in my name. Not in my name, because as you said, James, we know that a global pandemic requires a global approach. Because we know that all of the world's health experts, whether it's the WHO, whether it's the Global Alliance for Immunizations, all of our chief medical officers and health officers have said that if we do not get this virus under control globally, then we will never be safe here. And so whether, as I said, it's for those practical reasons, or whether it's because it's just what you do when you're a responsible global citizen, people in Canada need to tell the government that this is not what they want to see. They don't want us to be, we like to stand out. Every country wants to distinguish itself, but this is not the way to do it. And, one thing that I guess I should also mention is that we should remember we are a country that is, we're predominantly a country of immigrants, with the exception of our Indigenous peoples. How do you think it feels right now for people in Canada who have roots in other countries to know that the people that they love abroad are just a little bit less likely to be vaccinated because there is no access to vaccines, because Canada couldn't figure out a way to distribute the hundreds of millions of vaccines that it has already purchased?
And in follow-up, one of the issues you raised, and it's one that we keep seeing, is trying to get some accountability out of government. You ask a question, and often you're seemingly we're getting, it's like question period in the House of Commons, where if you ask how the weather is, they tell you they feel fine, and if your supplementary is to ask them how they feel, they tell you it's snowing outside. And what we need is the facts coming in, because I think Canadians are intelligent enough to be able to understand the issues if we get the truth. What can we do as Canadians to get that message across?
I'm reminded of that song last night. I don't know why it popped into my head, and I realized why now. That song by Bobby McFerrin, that big hit of his, "Don't Worry, Be Happy." And sometimes when I'm listening to our government, and when I was listening to Minister Gould last night explain why this was a good news story for Canada and for the world, that we were dipping into the COVAX facility, that's what I thought. There is just a frustration in terms of the lack of transparency. And you're absolutely right, James. People can take the truth. People in Canada want straight talk. Sometimes the news is going to be bad. We're in a pandemic, but we want to know what we can expect, when we can expect it, especially on a theme as important as vaccines. And the more we have our leadership at this critical time not being straight, not giving that straight talk, telling us again, everything's fine and all of this was planned and intentional, the worse off we'll be. You know, Minister Gould yesterday seemed to be explaining why this actually had been the plan all along, to take out doses from the COVAX facility. That's the first that I had heard it. And again, sometimes you just, let's not sugarcoat it. If we're doing this because our agreements with vaccine suppliers have not lived up to our expectations or were poorly planned, just own up to that and let Canadians know that we can take the truth.
Thank you.
Thank you, James. Micheline Laflamme, elle a une question. Allez-y, Micheline.
Oui, bonjour, Madame Paul. On a vu, en fait, sur le site du gouvernement, on voit que les doses de Moderna qui étaient attendues pour le 22 février, enfin, les chiffres ont disparu. On devrait avoir des nouvelles bientôt, mais est-ce que ça vous inquiète?
Oui, absolument, absolument. Chaque jour apporte des nouvelles notices et avis des réductions dans nos livraisons de vaccins. Oui, c'est décevant pour les peuples au Canada, surtout parce que nous avons commandé une énorme quantité de dosage de vaccins. Alors, je sais qu'il y aura, et moi, je sais que c'est difficile, c'est compliqué. Il y a des chaînes de livraison globale, il y aura des problèmes. Mais l'important, c'est de l'avouer, c'est de donner l'information d'une manière claire au peuple, les gens au Canada, et aussi aux provinces, parce que les provinces ont besoin d'organiser la distribution des vaccins. Et chaque jour que le gouvernement ne fait pas ça, c'est une journée de confusion, c'est une journée d'inquiétude, c'est une journée où les provinces n'ont pas suffisamment de temps pour planifier. Parce que si nous recevons nos vaccins d'une manière concentrée dans les prochains mois, soit en mars ou avril ou dans le deuxième quart de l'année, ça va être vraiment difficile, non, de vacciner, une énorme quantité de gens. Alors, c'est très important que le gouvernement soit honnête, transparent et clair avec les peuples au Canada et avec les autres niveaux de gouvernement sur notre calendrier de livraison de vaccins.
Et alors, à ce moment-là, je reprends un petit peu la question de David, mais lorsque, justement, on voit qu'il y a des écueils en ce moment là, quant à l'arrivage des vaccins et que, en contribuant à COVAX, le gouvernement aussi, et ça, je me souviens le premier ministre dès le départ avait dit, on va en recevoir une partie et on va aussi contribuer à ce que les autres pays plus pauvres puissent l'obtenir. Alors, est-ce qu'à ce moment-là, quand les gens voient qu'ici, on n'arrive pas à avoir les vaccins pour lesquels on avait des contrats, mais qu'on pourrait en obtenir d'une autre façon, comment on arrive à dire, ben non, je vais passer mon tour. Si on est le gouvernement, je dis non, je vais passer mon tour, puis le Canada attendra aussi, la population canadienne attendra.
C'est de passer notre tour parce qu'au final, c'est quelque chose qui va protéger les gens ici au Canada. Et c'est pour ça que beaucoup d'autres pays riches qui ont eu l'opportunité de prendre des dosages du mécanisme COVAX ont décidé de ne pas le faire. Si on ne soutient pas une stratégie de vaccination globale, si on prend des vaccins du seul mécanisme ou seule source de vaccins pour beaucoup de pays pauvres, nous allons prolonger notre pandémie, nous allons prolonger le danger pour les peuples ici au Canada. Et bon, le mécanisme COVAX, l'idée, c'était que tout le monde, tous les pays font partie du mécanisme et que les dosages et les vaccins soient distribués également. Mais le fait, c'est que les pays comme le Canada, ils ont fait des arrangements directs avec les fabricants. Et pour ça, le mécanisme n'a pas suffisamment de vaccins. Alors, si on garde tous ces contrats, et au même moment, on va chercher les vaccins dans le seul source de vaccins pour les pays pauvres. Ces pays n'auront pas leurs vaccins. Ils n'auront pas l'opportunité de vacciner leur population. Il y aura des mutations du virus et nos vaccins ne seraient pas efficaces contre ces mutations. Alors, ça, c'est vraiment, comme j'ai dit, c'est quelque chose de pratique. Si on veut finalement sortir de la pandémie, on doit le faire d'une manière coordonnée avec les autres pays du monde, de manière globale. Et si nous voulons être des membres du communauté internationale respectés, il faut aussi respecter que nous avons nous avons une obligation aussi à aider à protéger nos voisins dans la communauté mondiale.
Merci, Micheline. Thank you, Micheline. Next question is Jordan Press. Go ahead, please, Jordan.
Good afternoon. Listening to you, I'm struck by what you talk about the need for the government to be honest and to basically explain to Canadians exactly what it is that is going on with our vaccination efforts. But I'm wondering if within that, if you feel that in some ways the government may even be stuck between a rock and a hard place, if I can put it that way, because on the one hand, it can't get doses fast enough, and then on the other, when it works to get doses through COVAX, the way it was set up, it is accused of taking doses from poor countries. And so I'm wondering then, how do you reconcile those two issues, and how do you think the government should be reconciling it for Canadians?
They should be reconciling it in the same way that all of the other wealthy countries that have access to that facility and have chosen not to access that facility are doing it, by telling people in Canada that this is not, COVID does not end at our borders. Even if we succeeded tomorrow in vaccinating every single person in Canada, and of course our goal should be to vaccinate every person in Canada as quickly as possible, if we do not support efforts by the World Health Organization, by the Global Alliance for Vaccination and Immunization, in getting people in other countries, in poorer countries, vaccinated at the same time, then we will never be safe. The virus will continue to mutate. There will be new variants. We've seen several of them in Canada already. They will become increasingly resistant to the vaccinations and will be right back where we started. And so while it may seem like the quick and easy solution to get our vaccines out of that facility, It's not good for people in Canada. It is not something that is going to protect us. And at the same time, we need to be respectful, responsible global citizens as well. One of the biggest problems, of course, is that we entered into this facility, and when it was created, it was under tremendous optimism. Everyone was going to be involved in this. Everyone was going to pool their resources. All the vaccines were going to be pooled in this one facility that everyone was going to draw down from in a fair and equal way. But that is not what happened. Canada went, and other wealthy countries went, and they organized their own contracts directly with manufacturers, which means that already the global supply is very tight and is very concentrated in the wealthy countries. So if those wealthy countries don't leave COVAX for the countries who don't have any other option, then, as I said, we're right back where we started, which is leaving people in Canada unprotected, while at the same time leaving people to die elsewhere.
So then, is it, and to pick up actually what my colleague Catherine wanted to ask in French, which was, so then, are you saying that we should be giving back all the doses that we have received from COVAX? And if so, doing that even at the expense that we may not be able to vaccinate some of the most vulnerable that are right now without the vaccine in this country?
So I'm saying that, well, first, that's not the choice that we should have. Certainly for a country like Canada, who has already purchased enough vaccines to vaccinate our population 4 to 5 times over, the big question has to be, why is that not enough? Why are we not able to come to arrangements with those manufacturers to ensure that we can get vaccines without having to draw down from this one and only supply that many poor countries are dependent on? And so this is not a facility that we should be drawing from. I will say it, and I have not heard any other federal party leaders say that. We should not be drawing down vaccines from this facility because it already does not have enough. And it doesn't have enough because countries like ours have already snapped up far more than their fair share of the number of vaccines in the world. And we shouldn't be drawing down from this facility because we should understand that if we do that and people in those poor countries aren't vaccinated as quickly and at the same time as we are, then we are not safe, and we are leaving the door open for dangerous mutations, dangerous variants. And as I said, we'll be right back where we started. And I would say, in answer to your question, back when Canada announced, back when our Minister for International Development, Minister Gould, announced that we were joining the COVAX facility, what she said, and I quote, is that the COVID-19 pandemic will only be overcome through coordinated action around the world. We strongly believe that supporting other countries in their fight against COVID is crucial to protect Canadians at home. Canada is committed to supporting the COVAX facility and to ensuring all participating countries have rapid, fair, and equitable access to COVID-19 vaccines. The facility is an example of how multilateral cooperation can allow us to accomplish together what none of us could accomplish alone. So I will let the minister's words speak for themselves.
Thank you. Are there any other questions, please? Est-ce qu'il y a d'autres questions? No? Well, thank you everybody for coming today. Merci à tout le monde pour venir aujourd'hui. This concludes our press conference. Ceci conclut la conférence de presse.
Thank you everyone. Merci beaucoup. Bonne journée.